Hey everyone, hope you're enjoying the colder weather. It's time to load up on those vitamin C's, zinc, selenium, and probiotics to keep your immune system in full working order. I refused a flu shot for myself and my kids, and we've done fine without it for a number of years just by boosting our diet with the necessary phytonutrients and micronutrients. Doing this is more important now than ever before. So I've treated thousands of patients in my career, and it's a real joy when I can win over the most stubborn ones. I love hard cases, both in temperament and in clinical presentations, and I enjoy a good challenge. As a physical therapist, I get frustrated when patients don't get well after structural and muscular fixes with the modalities that I use. I typically get a good outcome, but there are times when my patient's pain is much more systemic in nature. By that, I mean that low back pain can be due to strain, sprain, and of course structural issues like herniation, degeneration, and facet issues. However, there's times when all those things have been addressed and the pain persists, and usually it's diffused and debilitating. This is when I look to more systemic inflammation as the root of such pain. When you have pain, while many times you can trace the pain to the cause, often there's not a clear-cut reason for the pain. What I do know is that when you've got underlying inflammation in your body, your receptors can be hypersensitive and responsive, resulting in decreased tolerance for pain. This issue is packed with many variables, but notably, the underlying inflammation is at the root. This inflammation can decrease pain threshold, which is your body's way of telling you something is a bit off. I'll use low back pain today as an example, because so many times, my patients' muscle and bone related issues are largely fueled by the systemic inflammatory processes in their bodies. Truth is that we all get old. As we age, not only do things not work as well as they used to, but they also degenerate at a speed that at times we're not ready for. Yes, it really is true. It sucks and it's hard getting old. But you can reverse this, which leads me to Dick. So Dick Peterson, one of my favorite patients, was very cynical and resistant to anything that I would offer initially when he first came into my office over a year ago with his lovely wife, Debbie. While Debbie was eager to get started with my care, Dick was sure that our program was not something that he wanted to pursue. At the time, his main concern was the low back pain that kept him from exercising, which he attributed to his recent weight gain and declining health status. At the time, he was struggling with some fatigue, water retention, and difficulty maintaining the weight. He was diabetic, hypertensive, and had high cholesterol. He was on a list of medications for his health issues, but he was concerned with the lack of control over his increasing body weight. Dick is and has always been a man of his word and very disciplined. He's used to exercising and watching what he eats, and the weight would usually come off. He came to me with not only unrelenting low back pain, but concern for his fatigue and persistent weight gain. At first, he was assessing our program. I gave him my clinical impression of how I felt the weight gain is due to the systemic inflammation, and the loading to his spine due to the weight around his belly is what was perpetuating the low back pain. I told him at that time too that he looked as if he was retaining water and noted his pitting edema around the ankle, which was concerning to me. Long and short of it was that he chose to go to another physical therapy center. That was almost a year ago. Well, after a few weeks of no relief at the other center, he decided to give me a try for his low back pain. And after just about 4 visits, he was all better and didn't need further treatment. But he returns approximately 3 months ago with unrelenting low back pain, severe fatigue, and labs out of normal ranges, so much so that he now had been referred to a nephrologist. He was so concerned and was ready to discuss how I can help. We were able to modify and meet his needs. He has a serious aversion to vegetables and was able to go through the 3 months of metabolic detox program, but not without problems. As he began to see results, he was able to modify his cholesterol, diabetes, and blood pressure medications. All were tapered down significantly due to less toxins in his body now. So his body was sort of regaining its balance again. So upon the completion, he reported significantly improved energy, absolutely no low back pain, and his foggy brain was completely gone. The link for Dick's full testimonial, thank you Dick, can be found below in the description box. So with that, I'd like to go a bit deeper into the concern of cardiometabolic syndrome, as it affects so many Americans in general, but is much more common for us autoimmune and lupus patients as well. Again, this validates my notion that there are no diseases, that there's only manifestations of our physiological imbalances. So, cardiometabolic syndrome can cause the following physiological manifestations: type 2 diabetes, cardiovascular disease, dyslipidemia, hypertension, erectile dysfunction, polycystic ovarian syndrome, cognitive decline, osteoporosis, obesity, sleep apnea, sarcopenia, which is shrinking of your muscle tissue. The list shows how today's topic spans the whole population, especially autoimmune patients. Due to high levels of steroids, pain, and difficulty moving, we begin to gain weight. And when this happens, we tend to gain weight around the waistline and around the organs of our body known as visceral adiposity. This fat gain causes inflammation, insulin resistance, fatty liver, fatty muscle, atherosclerosis, fatigue, foggy brain, and pain. Pretty soon, these fat cells are in your liver, known as fatty liver, in your muscles and other organs of your body and begin to act like their own endocrine organ. This begins to create disruption in our own hormone signaling and receptivity, which in turn creates more inflammation. As the dial turns up the heat in the body, our immune system becomes stimulated, our blood vessels become constricted, leading to hypertension, and our cells slowly become destructive due to too much fat and glucose, and they begin to die. The remaining cells then become toxic, and the metabolic fire becomes a hot mess. So the fat now becomes toxic as it enters our bloodstream as triglycerides, LDL, and HDL. The ultimate result is that we become insulin resistant because our cells have lost the ability to shunt the sugar and fat into the cells. Or if they do, they've caused too much shunting into the cells, so much so that the cells become burdened with fat molecules, rendering them unable to produce the energy that our body requires to function. So the ultimate reason for your fatigue is this: too much food creates a surge in blood sugar and fat. The pancreas responds by creating and releasing excess insulin, and the cells slowly lose the ability to shunt the sugar and fat into the cells to produce energy, which leads to increased sugar, insulin, and triglycerides floating around our body stream or bloodstream, all without producing energy. Over time, you can see how this can create a hot, messy soup of dysfunction, leading to disease. The point of today's blog is to let you know that we can reverse this. So for those of you who are struggling with this and have been told to watch your sugar, blood pressure, or cholesterol, please get serious about turning this around, as this can lead to worsening of autoimmune conditions or creation of them. So what can you do? Number one is simple. Eat a whole foods diet, mostly made by Mother Nature. Refer to our alkaline diet plan in my blog. The link is below. And take probiotics, curcuminoids, fish oil, and vitamin D. All these supplements, I have links for you as well. and exercise, as it is just as effective as medications in lowering cholesterol and decreasing toxic burden, as well as having an anti-inflammatory effect in your body. Number 4, manage your stress. Often we're hyperwired and our sympathetic nerve pathways are hypersensitive. We can improve this with meditation or guided breathing. Number 5, consider a comprehensive metabolic detox to lower your inflammation, heal your gut, and improve mitochondrial health. The links to all the above that I mentioned can be found on my blog with the link below. Please believe me, we can reverse our disease, prevent illness, and create health in our bodies once and for all. If you've enjoyed this episode, please share, comment, like, and follow us on our social media. I would greatly appreciate it too if you would subscribe to and rate our podcast called Health Made Easy, also link provided below. Thank you so much for watching and see you next week.